Hi, everyone, and welcome to today's webinar. Today, we'll be discussing how your integrative healthcare practice can confidently file claims for insurance reimbursement. My name is Kelli Noftle. I'm the Chief Administrative Officer here at ABC Coding Solutions, and I'm going to tell you a little bit more about how we can help you to grow your business and file clean claims for insurance reimbursement. Let's get started. So imagine getting reimbursed for your care with a strategy as simple as ABC. Take control and plan your income because you know that your patients want coverage for your care. And if you want more income, meeting this need is the fastest route to more revenue. Grow your practice with insurance referrals, or you can remain a cash practice, or both. The decision will be yours. Reduce your risks when filing insurance claims. Also, know which insurance companies will pay you for your care, and you can refer patients to insurers who will reimburse you for your care. Now, this all leads to focusing more on your patients instead of worrying about risk and income. We will work with you to help you set up your practice to file clean claims for integrative care while reducing your liability at the same time. So in today's webinar, we'll be discussing why billing benefits your practice and why it's always a benefit to your practice to bill for your patients. Why we are uniquely positioned to help you with this. And we'll also show a little bit of our third-party endorsements and talk about the providers who we've worked with in the past. How we work for holistic doctors and nurses. And what is included in a practice setup package. How do our services reduce risk? And the benefits of using ABC Coding Solutions. And then finally, how you can get in touch with us. So why ABC Coding Solutions? Well, we were founded in 1996 to overcome barriers to insurance reimbursement for holistic care. Our codes were also published by the National Library of Medicine in the year 2000. We are recognized by the American Nurses Association and over 20 other health professional groups. ABC codes document care delivered by over 2 million licensed professionals. We also develop insurance benefits and contract with providers and measure cost-effective options to medical care. Now, some of our third-party endorsements can be seen on our website as well. We can provide you with additional references if you'd like to discuss with some of our previous providers that we've worked with to get a better understanding of what their experience has been with ABC Coding Solutions and how we benefited their practice. And we can also provide case studies and data about, for example, how the state of Alaska saved 50% on the cost of filing claims using ABC codes in a demonstration project sanctioned by HHS. So how do we work for holistic doctors and nurses? Well, first, we identify practice risks before you start billing. We also review each practice's goals and your income needs. We ensure that this growth doesn't impact your existing income. And we work with you on your schedule and the time you're able to allocate to working with us. We track each task to completion using our project management software that is Hipaa compliant. And we do some test billing with up to 4 insurance companies. And then most importantly, we stay engaged with you until you are reimbursed by the insurance companies. So this leads into what is included in our practice setup package. Well, we document your goals and we get a better understanding of your preferences and identify areas that do need improvement. We maximize your scope of practice within your NPI, which means we help you select the right taxonomy codes and we update your NPI to accurately describe your scope of practice to the insurance companies. We review and we revise any handouts that you give to patients in the office, your current contracts with the payers, and the diagnostic and procedural codes you're currently using just to ensure accuracy. We also will train a medical biller for you, or we'll find a biller and train a biller for you from there. We also resolve any claim denials for 3 months after you start billing the payers. This project does take, the initial setup will take about 1 to 3 months, depending on the time that you can allocate with us and the status of your practice. But we do chart the results for you and we work with your schedule so that you stay in control. So, how do our services reduce risk? Well, the False Claims Act, under that, even unknowingly submitting a false claim to the government could be a potential violation of the False Claims Act because each instance could result in a fine of up to 3 times the amount of loss. And we're going to go over those penalties on the next slide. But we will help you avoid this liability with accurate claims and internal controls. So here is the False Claims Act penalty ranges. And as you can see, as of last year in 2020, the minimum penalty was just under $12,000. And the maximum penalty was a little over $23,000. So it's pretty serious. Congress expanded false claims to include state insurance exchanges in 2014. So before 2014, many integrative providers avoided false claims by opting out of Medicare and only accepting cash payments. But this no longer works. A cash practice is no longer a defense against fraud. And why is that? Well, you can't stop your patients from filing a claim for your services to their insurance company. So once the insurance company logs your bill into their system, it automatically becomes a claim and subject to the False Claim Act rules. So here, we have a slide about the Hipaa Title II specifically, which is the fraud and abuse medical liability reform. But most providers think that HIPAA is only related to patient privacy and data security. But as you can see from this chart, Title II also includes fraud and abuse. And fraud and abuse includes false claims that we just talked about. And those usually come from incorrect use of coding. But without expert help in setting up your practice, these are some pitfalls that you can fall into. How our service makes filing insurance claims fast, simple, and safe. Well, we ensure your practice is set up correctly before you start filing claims. We contact insurers and tell them how we plan to bill to get their approval before billing. We accurately code the care that you provide, which will help you map or tie the diagnosis to the treatment. And we ensure that your medical biller is trained so they know how to properly fill out the claim and how to code properly before sending it to the insurance company. We also test claims for increasing claim volume, and we follow up on any claim denials. So the benefits of our services, specifically for providers, we can help doctors code a patient visit in 3 minutes or less using our super bill, our customized super bill. We also help you bill for your full scope of practice, which I mentioned before with helping you select the correct taxonomy codes so that you are able to bill for your full scope of practice. You can also benefit of our service is meeting the federal CCI and HIPAA EDI requirements and staying compliant. And also, we assure documentation always matches the billing. We also benefit billers. We help billers save time and money. We help them accurately code the claims, as I mentioned before, and we will train them to use our specific ABC codes as well. Now, for payers, we also help them reduce fraud liability because fines also apply to payers or insurance companies. We also help them comply with provider non-discrimination rules, specifically Affordable Care Act, Section 2706, and we identify cost-effective options to medical care. All this will help you expand and improve your practice. We want you to take control of your practice using our affordable services to grow your income. We want to help you get your patients reimbursed from their insurance companies, and for you to take advantage of the political climate right now in healthcare reform. Follow a proven strategy for success. while reducing your liability and help your patients choose the insurers. There's a couple ways that you can get in touch with us. You can schedule a consultation, or you can go to our website to learn more, and I'm going to show you that in a moment. Or you can email us directly at info@abccodes.com. So here's our website, www.abccodes.com. And if you wanted to reach out to us and schedule a meeting, you can click on this red button, call us. It'll take you directly to a calendar where you can choose a date and time that we're available and you're available to set up a meeting with us over the phone. You can also go to Contact Us. And this is a simple form that you can fill out here with any questions you may have and send it to us, and we'll respond to you via email. Well, that concludes our webinar for today. I hope this has been helpful, and thank you so much for joining us.